Another potential medication that is known to actually work so well on heart failure is the Digoxin digitalis or the Digitalis Digoxin. Okay, so you can use this drug to manage heart failure conditions. Okay, so we'll look at this drug and look at the effect, how it is able to improve heart failure conditions, right? So the digoxin, which is actually a cardiac glycoside, is actually derived from the foxglove plant, okay? And it has been used for centuries. One of the oldest drug in managing heart failure, all right? It is still in use today. Beautiful. But basically, you should administer it with caution and close monitoring, okay? Now, this is due to its narrow therapeutic window because it will help to return the heart to the normal. Now, you can still throw the heart off. Do you understand? So, what are the uses or what are the functions? It actually increases contractility. So, digoxin strengthens the heart contraction, allowing it to pump more blood effectively. It slows heart rate. Digoxin helps to regulate the heart rhythm, reducing rapid heart rates and improving what? Diastolic function. It reduces symptoms. Digoxin can alleviate what? Heart failure symptoms like fatigue, swelling, and shortness of breath. Okay. It can also improve exercise tolerance. Now, by increasing cardiac output, it will do this, and also by reducing what? Symptoms. It can also help the patient bounce back to their exercise life. Okay, so digoxin enables the patient to perform daily activities with more ease. So you can see that digoxin can be used when there's loss of contractility and where there is some abnormal heartbeat and all that, right? So, however, digoxin should be used carefully, right? And this is due to what? Some potential risks. That's like the side effects, right? So toxicity. Digoxin has a narrow therapeutic window and excessive levels can lead to toxicity, causing nausea, vomiting, arrhythmias, and even death. Okay? Interactions. Digoxin can interact with various medications such as diuretics, beta blockers, certain antibiotics, and this can increase the risk of what? Toxicity. Monitoring. How can you be able to monitor digoxin? You could do blood tests, ECGs, and these ones are necessary to ensure that the digoxin levels remain within what you want. All right. Contraindications. Digoxin is contraindicated in certain conditions such as what? Ventricular fibrillation, Wolff Parkinson White syndrome, and severe kidney impairment. Right. Now, in modern heart failure, digoxin is typically reserved for people who are showing symptoms of heart failure with reduced ejection fraction. So there's a heart failure, and there's obvious that the heart is not being able to pump enough blood out. So you might want to administer this digoxin to increase the contractility of the heart. Okay. Then also patients that show up with atrial fibrillation and rapid ventricular response. So one of the effects of digoxin is what? It slows down the heart rate. The heart is contracting properly, but the rate is slow. Do you understand? To control all those what? Atrial fibrillation. So these are the possible drugs that can be used for heart failure. See you guys pretty soon.